Okay, I will be doing the bedpan, so I will gather my supplies. And the only supplies I need for bedpan is right here. We need one of these barriers that will go underneath them and a table cover. And now I will enter my patient's room. Hello, Mrs. Jones, how are you? Good, my name is Leslie and I'll be your CNA. You called because you need to use the bedpan, is that correct? All right, well, let me set up over here. How is your day going? Going good? All right. Let me move this close to you over here. The trash can is right here. Let me bring it close over here. That way, if you need it, let me pick it up. If you need it, you can throw your washcloth in there after we clean your hands. Let me put this here. Let me gel my hands because I touched that trash can. All right, let me give you some privacy. Let me open this drawer here, the bottom, because that's where you have your supplies that we need. Okay, now that I've opened that, I will gel again. Anytime we're gonna put on gloves on, you better make sure your hands are gelled right before. Put my gloves on so I can pull out your bedpan. Not right now, but I need to pull out the toilet paper and the wipes for your hands. Let me put this right next to you. Are you able to reach that? You are? Okay, great. Put this here. Now I will get this ready. So the patient will be always on the white part. They will be directly on it. So I always consider that dirty. I'll get this ready here. Everything is away from me. Now I'll bring it on this side because I have the bedpan on this side. All right, Mrs. Jones, we're gonna get ready to put this underneath you. Actually, let me set it right here. We're gonna have you turn to your side, or actually if you can bend your knees for me, excellent. And then I will ask you, still maintaining privacy, to lift your bottom part here, because that's what the students are gonna be doing. So you can be right on it. Let me come to the other side to make sure that the whole Chuck's pad is underneath you and we won't dirty the bed. And if I put tucked in really good, I just roll it out from there, making sure the gown is not underneath that. Now I will come. And now I can touch this. So again, I need you to bend your knees for me. Thank you. And let me get the bedpan, and on the count of 3, I need you to lift your hips. Okay, 1, 2, 3. Again, it's easier with a human, not a mannequin. All right, your knees are slightly bent there. You are not on your gown on either side, good. And does that feel comfortable? You feel that you're on it? If you need to fix it, let me know. Okay, you're good. So then I'm gonna take my gloves off now. Throw this in the trash. Make sure every time I take my gloves off, I am washing my hands or gelling. Especially if it's C. diff, we wanna make sure we are washing. Now I am going to raise the head of the bed, and you let me know when to stop. Because I want you to be able to be comfortable. That's good. Okay, I'll stop it right there. Are you still on there? You are. It's comfortable? Okay, great. Again, I need you to call me when you are done. So your call light is right over here within your reach. You're able to reach that? Okay, great. Call light is right there, and when you are done, please give me a call. Last thing I do before leaving the room is gelling my hands. Patient has now called back. Mrs. Jones, the call light, yes, you're ready to for me to clean you up and get everything ready? Okay, great. Let me go ahead and move this over here for right now. I want to make sure that you did clean your hands? Did you clean your hands? You can open it up and have them grab it and clean their hands. After they've cleaned their hands, if they're not able, you clean it for them. Have them toss it in here. But because I have already touched the trash can, I'm going to gel my hands before I put my gloves on. Okay. So Mrs. Jones, before I put the gloves on, I need to lower the bed, the head of the bed. Where are we at? You feel comfortable? Okay. Reach out here. Now I'll put my gloves on. Yeah, I hear they're having bingo today at 2 p.m. Are you excited? Yeah, I am too. I'll be taking you there as well. All right. Now on the count of 3, I will need you to lift your hips up. 1, 2, 3. Great. Now I'm going to cover this up here. Everything is away from me. I will come to the toilet area. I will get a paper towel. And I forgot we took our toilet over here, so let me bring it quickly. I completely forgot. Don't know how to edit that, but take 2, okay? I'll get paper towel here, lift this up. We'll pretend that hat was not on there. Grab this, throw it in the trash can. From the narrow side, not the wide part, I will throw in there. Now I'm going to turn some water on because I need to rinse the bedpan. Rinse it good. Throw it in there. Everything is nice and clean. Flush the toilet, right? So I'll go ahead and now dry it really good. Away from me, everything is dried. I will get one for the road. I'll come over here and grab the toilet paper. I left this open, but if it was closed, I would open it with a clean paper towel. Put this here. Mrs. Jones, you have already cleaned your hands and threw the wipe in there. Put this back in here. And I'm using the paper towel because my gloves were dirty. So I will get this here. Grab this, put it in the hamper. All right, Mrs. Jones, let me take my dirty gloves off. Throw it here, gel my hands. All right, make sure you're nicely tucked in bed here. The gown is down. Let me put this call light within your reach here. Okay, would you like the privacy curtain open or closed? All right, open. Let's open this up. Are you fine with the overbed table here? That way it's within your reach for your stuff. Great. I'll make sure the bed is lowered. Okay, and it is locked. And it is locked here. Again, Mrs. Jones, my name is Leslie, your CNA. I'll be here till the end of shift. And I'll see you later on for bingo. Okay, if you need anything, just use your call light. Thank you so much.